Hello, everyone. Good evening, and welcome to a virtual discussion about COVID 19 and its effects on the African American community. This event is brought to you by the Jackson Hart Study Undergraduate Training and Education Center at the historic Tougaloo College. I am Lavelle Williams, your 20th Mr. Tougaloo College. I am a senior mass communication major and English minor and a Jackson Hart Study UTEC scholar. It is my pleasure to be mediating this event along with Ms. Cherie Thomas.
Hello, everyone. I am Sidonia Cherie Thomas, and I serve as the current Student Government Association parliamentarian. I am a senior biology major at Tougaloo College, as well as a Jackson Hart Study UTEC scholar. Before we begin, I would like to go over a few housekeeping rules just to maintain order during the program. First, this meeting will be recorded for future use. Secondly, in the interest of time, all questions will be reserved for a Q&A session in the latter part of the program. Please type questions in the chat to be addressed during the Q&A. Please use the Zoom hand raise function during the Q&A and wait to be acknowledged before asking a question. Please keep in mind that we would like all questions to be no longer than 30 to 45 seconds, and follow-up questions depend on the time available.
Thank you, Cherie. In the interest of time, we will present abbreviated bios for our esteemed panelists, beginning with Dr. Paul Byers. Dr. Byers earned a BS in biology from Millsaps College in Jackson, Mississippi, and attended medical school at the University of Mississippi School of Medicine, completing an internship in internal medicine. He began his career at the Mississippi State Department of Health in 1993, providing direct patient care at the county health department level and serving as the medical director for the dedicated STD clinic for several years. In 2005, Dr. Byers moved to the Office of Communicable Diseases, serving in multiple positions, including medical director, deputy state epidemiologist, and acting state epidemiologist. In 2016, he was appointed state epidemiologist. Dr. Byers provides medical direction for the Office of Communicable Diseases, which includes the offices of immunization, STD and HIV, and tuberculosis. Dr. Byers has authored multiple publications and has given numerous presentations about epidemiology and public health.
Next, I have the esteemed pleasure of introducing Dr. Thomas Dobbs. Thomas Dobbs, MD, MPH, was appointed State Health Officer with the Mississippi State Department of Health in December of 2018. Dr. Dobbs is an infectious disease physician with 20 years of experience in public health, with specific expertise in TB and HIV. He served as a regional health officer in Mississippi from 2008 to 2012, and as a state epidemiologist from 2012 to 2016. From 2016 to 2018, Dr. Dobbs worked as a clinical and chief medical officer / chief quality officer for a local health system. In addition to his roles at the Department of Health, Dr. Dobbs is an associate professor at the University of Mississippi Medical Center School of Population Health, teaching courses in epidemiology and health policy.
Also with us today is the esteemed Dr. Marshala Lee. Dr. Lee graduated from Tougaloo College in 2008 and was a Jackson Hart Study scholar. She is a board certified family medicine physician and the director of the Harrington Value Institute Community Partnership Fund at Christiana Care. She is responsible for strengthening community partnerships, mentoring pre-medical students from underrepresented backgrounds, and developing new models of patient-centered healthcare that address the social determinants of health. In her free time, Dr. Lee serves as the co-chair of the Wilmington Alumni Chapter of Delta Sigma Theta Sorority Incorporated's Physical and Mental Health Committee, a health contributor for the Metropolitan Wilmington Urban League, and the secretary of the first state chapter of the National Medical Association. Dr. Lee obtained a medical degree with a concentration in advocacy and activism from Brown Medical School. She completed her family medicine residency training at the University of Maryland Medical Center. Following residency, Dr. Lee was chosen as a Commonwealth Fund Fellow in Minority Health Policy and obtained a Master of Public Health with a concentration in healthcare management and policy at Harvard.
Finally, our guest panelist is Dr. Ashish Jha. Ashish Jha, MD, MPH, is KT Lee Professor of Global Health at Harvard T.H. Chang School of Public Health and Director of the Harvard Global Health Institute. He is a practicing general internist and also Professor of Medicine at Harvard Medical School. Dr. Jha has also been appointed the next Dean of the Brown University School of Public Health. Dr. Jha received his MD from Harvard Medical School and then trained in internal medicine at the University of California in San Francisco. He completed his general medicine fellowship in Birmingham and Women's Hospital at Harvard Medical School and received his MPH from Harvard T.H. Chang School of Public Health. His research endeavors focus on improving the quality and cost of healthcare systems with specialized focus on the impact of policies. Dr. Jha has published over 200 various papers in prestigious journals and heads a personal blog, which focuses on using statistical data research to improve health quality. Nationally renowned, Dr. Jha has been featured on CNN's Cuomo Primetime. Dr. Jha is a member of the Institute of Medicine at the National Academies of Science, Engineering, and Medicine.
And now we will have a welcome by the president of Tougaloo College, Dr. Carmen J. Walters.
Thank you, Lavelle. I am very, very excited to be here. Thank you to both of our wonderful students. Listen, this panel, I am just so excited to have you all talk to us today. Dr. Dobbs probably has deleted my number out of his phone because we have called Dr. Dobbs and we've sent our plan to him and Dr. Sutton. So we are joined together in this effort of trying to meander through COVID. I'm so excited to see all of your faces and to just be invited to such an esteemed meeting with such an esteemed panel. I want to thank Dr. White and Dr. Chamberlain and all of our deans that are on, all of our faculty and our students. I can see the numbers just going up. More and more people are engaging with us. Welcome to Tougaloo College. Tougaloo is such a historic place. Many of you know a lot about Tougaloo. It's the cradle of the civil rights movement. Many of you are aware that it was a former slave plantation. It is a beautiful campus where we have more doctors in the state of Mississippi that graduated from Tougaloo than any other institution almost. So we are just ecstatic about the work we do. And the people that are on this call with us, our students, Lavelle is one of our leaders here that helps steer the ship. And so we are proud of him and happy to have him be engaged with this. Tougaloo wants to partner with you in any way we can. We want to do what is right for the right reason, and that is for our students to make sure that they are exposed to leaders like yourselves and that they understand their role and responsibility once they leave Tougaloo. And 20 years from now, this group will be doing panels like you're doing to talk about whatever is happening in the future that we can't see now, but they will be prepared. I often say we are preparing students for work that they don't even know about yet. And that's the thing that is so important to me today, is that they keep their minds open, they grasp everything we share, and that they know that the road from Tougaloo can take them anywhere they want to go. So I want to thank you for this time. I can't wait to hear the session. I'm sitting in my office and I have my notes ready, Lavelle. So just be ready to help me through all of this because you know where I am on this. Thank you, Dr. White, again. Thank you, Dr. Chamberlain, Dr. Mao. I think I saw your name on the list. And to all of the panelists, thank you so much for choosing to do this with us. We're excited to hear from you, and we know we're going to have our minds expanded. Thank you and enjoy the rest of the event.
Thank you so much for that warm welcome, Madam President. Dr. Jha, may you provide the audience with a brief update of the coronavirus numbers and where the United States stands on the global stage.
Sure. And again, thank you, President Walters, and for everybody else for welcoming us. And big thanks also to Dr. White, who's been a great partner already. I have not yet started my job at the Brown School of Public Health, but I know the relationship between Brown and Tougaloo is a long one and one that we want to build on. And so it's been a pleasure to get to know Dr. White through this. And I'm very, very pleased to be invited. I won't go on too much longer beyond just saying, when we take a big picture look at where the country is on the pandemic, the way to think about this is a global pandemic. About 20 million people in the world have been infected that we know of. About a quarter of those are in the United States. And the US is unfortunately not one of the leaders, not in a good way, in terms of handling this disease. About a quarter of the folks in the world who've been infected are here, and about a quarter of the people who have died from this disease so far are here in the United States. And there are a variety of reasons why I think this disease has spread as much as it has here. But single most important among them, I don't know if I'm saying the single most, one of the most important reasons is we just have not taken the virus as seriously as many other countries have. And so in large parts of our country, we are seeing still large outbreaks happening. But those outbreaks are not happening randomly, and they're not distributed evenly. And one of the things that this pandemic has really made plain and exposed is longstanding inequities in our healthcare system and in our society as a whole. So when you look across the country, whether you look at data from Texas or New York or Mississippi or Florida or Michigan or really any state in the union, what you find over and over again is that the virus has disproportionately affected minority populations, disproportionately affected poorer populations. And there's a set of reasons, I think, behind that, that we have to grapple with. And I know we're going to spend more time getting into that, and I don't want to take too much of that space up, but we'll have a chance to talk more. But there are fundamental underlying societal structures that we've had as a country that have really been exploited by the virus to disproportionately impact certain communities, certain populations, both in terms of number of infections as well as number of deaths. And so as we look at this pandemic, we are going to have to take an equity lens as well as just a regular standard infectious disease lens to address it. So let me finish off by just saying, looking forward, I had the privilege to spend time on Friday interviewing Dr. Tony Fauci as part of a Brown event. And when we talked about the future in the fall and winter, he said he was optimistic if we could get our act together, if we could get people to wear masks, if we could get people to manage social distancing and avoid certain high-risk activities. And that conversation really left me with hope that as we look ahead, we as a country have not done very well in the global stage, but the pandemic is not over. It's not even halfway done. And we can make sure that the second half goes much more smoothly than the first, but that will really take collective action among all of us. So let me just stop there and turn it over to our next speaker. But I want to say again, thank you for having me be a part of this esteemed panel, and I look forward to a rich discussion after people have had a chance to say their remarks.
Thank you very much, Dr. Ja, for that update. Now, Dr. Dobbs, if you would, can you please give a similar update about the state of Mississippi's latest coronavirus numbers?
Yeah, well, thank you so much for including me in this panel. I really look forward to visiting with everyone and some rich discussion. So, Mississippi, in so many other ways, seems to top the list of bad at some point or the other, right? So last week we had the highest per capita rate, the highest percent positive. But I'd like to focus on some other things that I think are really telling about what our experience is in Mississippi. So in full disclosure, we really got caught flat-footed on the front part of this. Not so much because we didn't anticipate it or weren't worried about it, but our focus early on was on travelers. And it was weeks into the pandemic before we realized, and I can remember Dr. Byers and I talking about it, and we said, well, we really need to look and see what what's going on in the Black community with coronavirus, because the early assumption was it was just coming in from foreign travel. And there was just so much energy put in that. And then we were looked at it, we were astounded. We actually had to go back and double check it to make sure we didn't make a mistake. And so I think that's very telling for a lot of reasons, in that we need to make sure that when we consider new and evolving threats, that we have to use a health equity lens early and not wait until it's so abundantly apparent that it's already, way worse than you would expect it to be. That affected some of our communication strategies early on too. And from our conversations with a lot of leaders in, let's say, the Black community, or in the Latinx community, or even in the Native American population, Mississippi Band of Choctaw specifically, we weren't really at the front edge of it. We were always trailing, and we're still there. We're still behind, trying to make sure that we get those resources, the communication strategies, and everything really right sized to where the need is. And even now, when we're seeing, there's been a little bit of a balancing, where we've seen a little bit of equalization well, equalization by numbers, but not by proportionality, right? So still within Mississippi, if we look at who's mostly affected per capita, by and large, Native Americans are the worst. They're hit extremely hard, and we've had good partnerships with those guys, and we're excited to be doing hopefully a universal testing strategy with a lot of the Mississippi Manic Choctaws next week, in partnership with the chief and his leaders. And then we look at the Latina population, um, which is an entirely different conversation. This is also in the setting of the biggest ICE raid ever. We had the anniversary this week, right? And so there's a lot of native distress. And when we do our testing events, if y'all have been to our testing events, who are we using to help with their testing? It is the National Guard. And if you want to go somewhere and discourage Hispanic folks from coming out and get testing, why don't you bring a bunch of people in military uniforms? And so there's all these other sort of barriers we need to be thinking about when we think about our interventions, not even to mention the communication barrier, and then the other fears, and then also the access to healthcare issues. And that does also get to the African-American community, which really, if we look at the bulk of the numbers, if we look at the bulk of the deaths, is really where the weight has fallen, and needs to be, in large measure, really the focus of what we do in our considerations as far as our strategies going forward. So anyway, I look forward to a great conversation. I can say that we're starting to see a little bit of stabilization in hospitalization rates. We've seen a little bit of an improvement in our daily case counts, but I'm gonna tell you, we're always very reserved in making any pronouncements. There could be some subtle shift, or there could be, maybe LabCorp's got 10,000 labs are waiting to drop on us next week. So we got to approach this cautiously and use those simple things that we know that work. We know that the space, the proximity, the time, the face masks, the group size is so important. And not only are we fighting to make that happen, we're also fighting a lot of misinformation and sort of bizarro myths. It's almost become what used to make me aggravated is now making me amused, because it's just so preposterous, the things that we have to deal with. Anyway, thank you so very much. I'm very happy to be here and look forward to continuing our conversation this evening.
Thank you, Dr.
Well, thank you so much, Dr. Dobbs, for that update. This next question is for the entire panel. So, what has been the existing health disparities between African Americans and other ethnic groups that affect COVID health outcomes?
May you repeat your question?
Yes, ma'am, no problem. So the question is, what has been the existing disparities between African Americans and other ethnic groups that affect COVID health outcomes?
Okay, I can start. And so we know that pre-existing conditions such as hypertension and diabetes put communities at increased risk for having worse mortality rates and outcomes from COVID-19. And in many places across the United States, African Americans have been affected by COVID-19 2 to 3 times on average more than whites, and in some states as much as 6 or 7 times But because of, I think, the pre-existing disparities, chronic diseases, the conditions that exist in Mississippi, as well as the overall low socioeconomic status of Mississippians, the disparities are not as stark in Mississippi for Blacks and whites as they are in other states. And I really think because it's attributed to the overall poor health of Mississippians in general. And so the disparities aren't as stark between races because and on average, Mississippians had a higher rates of heart disease and diabetes, which weren't as different between the races. And so in Mississippi, African Americans have comprised approximately 23,000 of the 67,000 cases. So that's not even half of the cases. But in other states, the disparity is much greater. And I think it goes back to the larger, the poor health status of Mississippians in general going into COVID-19. We call it a acute on chronic disease that's going on right now. And Mississippi just had a overall poor chronic disease status to begin with.
Let me just jump in here if I may, and I'm not going to be able to speak quite as much about Mississippi, but let me talk about at the national picture what we know on health disparities and how it has collided with COVID-19. So Dr. Lee, I think, laid out some of the critical issues around risk factors for cardiovascular disease, diabetes, hypertension. Where we do see much higher rates of both diabetes and hypertension in the African American community more broadly in the United States for a variety of reasons. But one of the areas that I think has gotten less attention, but something that a group of us have been very worried about and have been looking at, is how the health system is responding. So there is, of course, the inequities in our societies and the disparities that are caused by social determinants. But even beyond that, the health system itself often perpetuates and worsens these disparities. And so there's been a lot of work, for instance, in simple things like testing sites. Where do you set up sites to test people? What we see is that they're much less likely to be set up in communities that have high proportion of minority populations, particularly African Americans. There's some stories of how in some of those testing sites that were set up in places that were drive-throughs where you couldn't walk up. And yet what you see in a lot of communities is that African Americans are less likely to have cars. And if you got sick, you couldn't go to the drive-through testing place because you don't have a car and you could actually walk to it. But that wasn't one of the choices. So simple little things that essentially perpetuate existing disparities. And then let me just throw out one more really important issue, an area that we've been working on for quite a long time, which is when you look at the healthcare providers, the doctors and the hospitals that disproportionately care for Black Americans, you see that they're less likely to be well-funded, have fewer tools and capabilities, less access to specialist care. A lot of the things are really important for critical care on African Americans across the United States. So there are a set of issues in the healthcare system that take the social factors where there are already inequities and worsen them. And to finish off with a thought, one of my heroes, somebody I learned a lot from when I was a very junior person before I had as much gray hair as I do now, is a very famous physician, Dr. David Satcher, who was a former Surgeon General of the United States. And on a panel I was on with him, Dr. Satcher said, time and time again, he said, we know there have been longstanding inequities in our society, and we'd always hoped that the healthcare system would be part of the solution. But time and time again, we find that the healthcare system can at times be part of the problem as much as it is part of the solution. So when we emerge from this pandemic, I think we're going to have to look at not just the social factors, which have been so important, but also look at the healthcare delivery system and see what else can we be doing to try to reduce the gaps in care.
Thank you very much, Dr. Jai and Dr. Lee. For the benefit of our audience, Dr. Byers, would you mind providing a crash course on what exactly epidemiology is and how important it is during this time? Uh-oh, you're on mute, Dr. Byers.
There we go. Hey, thank y'all. I was talking away. No, that's a great question. So epidemiology is basically the study of diseases, and in our office we do infectious disease epidemiology, and how it impacts the public. What are the underlying medical problems that make somebody more likely to develop a particular disease, and then with taking that information, who is it impacting? How is it impacting them? What are their risk factors? And then taking that next step. What public health interventions can be put in place to try to prevent further transmission down the road? So it's not just looking at the data, it's looking at the data and letting that help you direct your activities. Who are the people at risk? Where do you need to put your biggest efforts to try to prevent transmission? And that can take a lot of different sort of ways to look at it. Sometimes it can just be, you know, for example, you know that there's a bunch of cases of salmonella. You do your investigation and you identify that the reason that all these people have salmonella is because they ate at a particular restaurant, and now you go and you either close down that restaurant or you make some changes within that restaurant to prevent further transmission of salmonella. So that's a public health action. Um, when we look at a large pandemic like COVID-19, it's certainly not as simplified as trying to look and determine a restaurant that may be associated with salmonella. There are lots of different factors that we have to look at. So the first thing that we do is we need to get those cases reported to us. So we work with doctors to be able to report all of the positive cases to us. And from that point, we do a very intensive investigation to interview the patients, to identify where did they maybe get it, what are the risk factors that impacted that transmission, and you know, make sure that they get put on isolation, and then take the next step and determine what are the underlying medical problems that they have, where did they get tested, what is their racial makeup, what's their ethnic makeup, and begin to paint that picture of who is COVID-19 impacting in Mississippi. And then unfortunately we have deaths, and we look at those very closely as well to determine what are the underlying chronic medical problems, who are the individuals that are more likely to die, where are they? Certainly we see, tragically, a lot of our deaths have been in our very vulnerable populations living in long-term care centers. And that has had a huge impact on the state. And so, you know, we build out, we start with that general information, and then we work out as specifically as we can, because we want to look at every aspect of who is getting COVID, how they're getting it, and how it's impacting them. And then from that point, we begin to look at what are the next steps that we need to do to try to prevent transmission. You know, a lot of it is the same messages that we all say: wear a mask, social distance, don't get into big crowds, you know, get tested when you're symptomatic, isolate when you're a case, quarantine if you're a contact, get tested if you're a contact, all of those sorts of things. But it needs to be more nuanced, right? It's not a one size fits all message. And that's where the real work begins, on how to get to those populations that are more impacted in a way that that message is delivered, you know, so that you understand your risk and understand what measures you need to put in place to protect yourself.
Yes, sir. Yes, sir. Thank you, Dr. Byers. And so, with all this information kind of on the table, can we look at how students can better protect themselves during this time of COVID-19? And that is a question to the entire panel.
I'll start. And so one of the biggest things that students can do to better protect themselves is follow the guidance that has been given to by the CDC and other reputable sources, such as staying home. I know that the state fair is open. If you're going to the state fair, wear a mask, still socially distance, be safe. We know that, the world is still going on, but we always have to remember you don't want to risk one day of pleasure for possibly the life of either yourself or your loved ones. We've been talking, we have to change the language that we use. We've been referring to people as cases and deaths. These cases are not just cases, but they're loved ones, they're family members. I had two classmates last week who buried their parents in Mississippi. And so we have to be able to communicate on that level and let individuals know that yes, you want to live on and have fun, but you don't want to sacrifice the day for the life of one of your loved ones. So just continue to abide by all the guidance that is out there.
Thank you, Dr. Lee. Um, Dr. Jha, do you have any opinion on that matter, especially from the national standpoint?
Well, yeah, I didn't speak up because I was going to end up just echoing, but not as well, what Dr. Lee had to say, but I will just offer a couple of thoughts. It is tough. People are getting tired. It feels like the pandemic's been going on for a while, and there are lots of days still ahead of us. But what I try to point out to folks is it's not just about your life, it's about life of your loved ones. And we are going to get through this. And so if you look, we're not saying you got to give up everything in life, but if you can, when you're out and about, wear the mask, avoid large indoor gatherings. I think we have a sort of 6 to 9 months ahead of us before we will have a vaccine that should be safe and effective and hopefully widely available by then. And life will really start to turn in a positive direction and things will start getting better. And so if we can all do our part during this time period, this very difficult time period, we will get through it. And when we get through it, we can get a lot of our lives back. But it would be unfortunate for people out of impatience, and which again, I understand, to make decisions that ultimately end up being very costly for the long run when this is really ultimately a short-term problem that we have to get through.
And if you look at kind of what our experience has been is where people are getting the virus now, it's pretty much universally moments when people let their guard down. When as a great example, where do people get coronavirus at the hospital? Well, you'd figure they'd get it from patients, right? Our experience has been is that most people get coronavirus in the hospital from their employees who they share it over the break room, having coffee, or at moments where people are eating or relaxing. The same thing translates in the college campuses where we see our risk. And when we're planning with the colleges, the least thing I'm worried about is the classroom. I mean, there are preparations that need to happen, no doubt, but it's the parties, it's the dinners, it's the rush parties where we see not only do we see people letting their guard down, but we see a lot of people gathering at a singular time when we could have these sort of super spreader type events occur. So understanding where our risk is very important. It's going to be extremely challenging to keep our young folks from taking on these risky behaviors. I mean, that's a lot of what public health is anyway, is combating risky behaviors. And this is just a new one, but unfortunately, hopefully it should be a temporary risky behavior.
So, our next question is: historically, the African American community has experienced many abuses in relation to both healthcare and public health. In contrast, historically Black colleges and universities have always strived to provide agency to the Black community. How can HBCU students and alumni today act as public health agents of change in the midst of COVID-19? Dr. Lee, with your background as a Tougaloo and Jackson Hart Study alumna, perhaps you have something to say to this matter.
Thank you for that question. So, because of the injustices that have occurred in the name of medicine and public health, it's very important that we build bridges and long-term trustful relationships with communities. And those relationships aren't built overnight. So you can't try to build those relationships in the middle of a disaster or an acute pandemic, because the messenger matters and trust matters. And so in Delaware, some of the things that we've done is that we know that the health systems don't have the most trust in some communities. And so we've partnered with organizations that are trusted partners, so barbershops, salons, and churches, to disseminate education and encourage people to get testing. And so similar interventions could be achieved by Tougaloo students and graduates, initiatives that increase the community's participation in testing, and possibly even hosting testing sites on campus or in other trusted community settings, because we know that because of stigma, oftentimes people may not want to go to hospitals for testing. Thankfully, we've been able to have testing at our community centers, churches, even at funeral homes, unfortunately. And that's really what Mississippi is probably going to need to do to be able to get ahead of the curve. And I definitely think that Tougaloo College and other HBCUs in the state can be good partners in expanding the testing and encouraging people to abide by the guidelines.
Thank you so much.
Thank you, Dr. Lee. And at this time, we will open for a Q&A session. Please note again that because of time delays, we will not necessarily be able to acknowledge every question. Questions will be addressed from the chat box, and those who would like to unmute themselves and speak should use the raise hand function in order to be acknowledged and unmuted so that they may. And Cherie will begin with one of our questions from the chat box.
So the first question is, do you all think it's necessary for college campuses to offer testing every day of the week?
I think that testing should be available routinely for people who are ill or exposed. You know, certainly one of the questions we get is routine testing for kids coming back on campus, and for a whole host of reasons, we don't think that's practical or advisable. But certainly for people who are at risk, if they're a contact to a case, or if they're ill, yes, ready access to testing is going to be very important.
Okay, and here's another question directed at Dr. Jha. If you could take the lead on the response to the virus in Mississippi, as well as regionally, what would that look like? Can you give the top 5 bullet points on what you think needs to happen now?
Sure. So if I could be the coronavirus czar for Mississippi, here's what I would do. So 2 or 3 things. First of all, some of which has I think there's been progress on just in the last couple of weeks. But I would not only have a statewide mandate, but I would make sure it was enforced for mask wearing. I think we have very clear evidence that wearing masks really makes a big difference. And I think everybody needs to be wearing one when they're outside of their home. So that would be my number one. Number 2 is I would, given where Mississippi is right now, the 20% of tests are coming back positive. Case numbers are still quite high, among the highest in the country. I would really make dramatic reductions in indoor gatherings. So I would probably close bars, indoor gatherings, indoor bars. You can have them outdoors, but not indoors. Indoor dining, gyms, any other indoor gathering until you've brought the virus levels way, way down. Third is I would focus quite a bit on testing, and I would try to work on improving the testing apparatus. And as I alluded to already, given the disparities we've seen in where testing has been placed, I would absolutely make sure that any efforts to expand testing focused on traditionally underserved communities and making sure that those communities have access to testing. So that would be number 3. And let me just add maybe 1 or 2 more. I do think that if you're going to think about getting kids back to school, which I know has been a big issue, you got to think about things like how to improve spacing in schools. You've got to work on social distancing. And then last but not least is I would take a very careful look at what the situation is in hospitals across the state, particularly hospitals that care for vulnerable populations, and make sure that those hospitals are well stocked with PPEs and other equipment so that as patients come in, that these hospitals are ready and capable of taking care of people. So that's my little list.
So this question is directed towards the entire panel. What are you all's thoughts about African Americans and other communities of color being open to receiving the vaccine when it is available? This question, the person who asked this question went on to say, my informational polling suggests it would not be widely accepted due to long-standing fear and mistrust.
So even as an African American physician, I know that I'm a trusted voice in the community. And so in order for me to be able to advocate or encourage my community friends and others to get the test, I would need to see safety data and have a better understanding of the effectiveness. And right now, there's been a rush to get the vaccine out, understandably, because we need to bring cases down. But prior to it being deployed, I would want to have more information and understand the side effects and effectiveness so that I can be an effective voice for advocating for something that I believe and trust. Because if we could do more damage by providing a vaccine that's not safe, because yes, COVID-19 is the issue of 2020, but there are other future events and health challenges that we're going to face. So we have to roll out the vaccine in the proper manner and make sure that we don't cause harm to underserved populations.
Thank you, Dr. Lee. And a little bit more of a general question. Um, we know that COVID-19 affects children largely, and then they can bring the virus to their home environments. Do you all have any commentary on the role of pediatricians during this time?
Well, one of the things that we've seen in Mississippi is they've been also great to help plan for return to school. There's so many schools, and the Mississippi AAP has been fantastic about not only advocating for safe schools, but for making recommendations to delay school, which was a strong statement, which was different and somewhat in contrast to the national chapter or the national group. They are certainly extremely valued members for parents, and they have a great voice that needs to be used. And early on, when we were in this, we did partner with Jackson State to do a poll of community members to see what perceptions were and around coronavirus. And one of the things that we found pretty quickly was that the personal physician is the most trusted health voice that there is by far. And then CDC was down from them a little bit. So for the media guys, sorry, y'all are kind of low on that list. But yeah, no, they're a trusted voice. Your personal physician is the most trusted health voice that there is.
Thank you very much, Dr. Dobbs. Dr. Byers, do you have any commentary on the current shift of the state of Mississippi from a hotspot to a state of, just getting away from that area? Is it happening? And if it's not, how can we cause it to happen exponentially?
I know that's a great question. I'm not certain that it's happening yet. I mean, we might see over the coming days some little bit of flattening out of the numbers of cases, but they're still way too high on a daily basis. We're still seeing high numbers of deaths throughout the state, and so we're in a time right now where not only are we seeing more cases, and certainly we're at the peak of our activity thus far. We're on the precipice of, with schools and colleges returning now, where we may see some higher levels of transmission still, especially as kids get back and kids start interacting. We've already seen some of that in college settings now, even before school has started. When they get back and they have parties and get together, we've already seen some significant numbers of cases. So, you know, it would be great, and I love the message of hope. Um, but if everybody could look at where we are now with an understanding of, we did not expect it to be this bad in the summer. We thought we were going to have a little bit of a lull before we started back at school. And it's actually been, in these last couple of months, our worst months so far. If we could use that as a springboard for understanding that now is really the time to get to work. Now is the time to start putting in place those things that we've been talking about the whole time, about wearing a mask, about limiting your social gatherings. Even if the bars aren't closed, don't go to the bars. Even if the gyms aren't closed, don't go to the gym. I mean, even if those things are not closed, we can still make decisions not to do those things. Don't go to the restaurants, in a crowded restaurant, and sit inside with 10 people at your table, because we've already established how this is transmitted. So, you know, I think it's going to take really a collective effort to have that understanding of personal responsibility, to be able to understand what you've got to do to prevent that case and the person next to you. And if we all will make a decision right this minute to act as if everybody that we come in contact with is potentially a case, and we also act as if at any point in time we could be that person that can transmit it to other people, then, you know, we can actually start to see some real reduction in cases. You know, there's only so far that more case investigation, contact investigation, contact tracing can do, because when you think about the number of cases that are out there that never get reported, that never get diagnosed, the number of people out there who are asymptomatic, who still can transmit this infection, you know, that's not going to get us where we need to get. Where it's going to get us is for us to start buying into these activities and these measures that we know that have already been shown and proven can reduce the risk of transmission. So that's Paul's soapbox.
Thank you so much, Dr. Byers. We have a couple questions asking about, with the fall season coming up, how will the flu affect COVID-19? Also, one person asks that it was mentioned earlier that a COVID vaccine could be developed and sent out in the next 6 to 9 months. But could COVID become a reoccurring disease such as the flu?
Why don't I start? Well, why don't I start with the vaccine, and somebody else can take the flu, or I can come back to it if you want. So the key thing to understand is that this coronavirus doesn't change in the same way that an influenza virus does. And so we have to get a flu shot every year because every season we're infected with a different flu virus. That will not happen with the coronavirus, just a different enough virus. The issue is, though, that we don't know how long immunity from any vaccine we develop will last. And so we're working on developing a vaccine. As Dr. Lee said, it is absolutely critical that we take our time and do it right, and we have a vaccine that's effective and that's also shown to be safe. And once we have that, and once we make it widely available and make sure that the highest risk individuals get it first and that it is widely deployed, one of the key questions will be, how long is it going to last? It's probably not like many of the other vaccines, like a measles vaccine, which once you get it, you're good for a long time. It might be that with the coronavirus vaccine, you may need to get it every year. And not because the antigens are changing the way they do for the influenza vaccine, but just because your immunity may not last that long. So we'll have to sort that part out. We just don't know. But it is entirely possible that we'll be getting vaccinated for COVID every year. But that just depends on how long the immunity lasts from the vaccine, which we don't know, because obviously this is a brand new virus and we haven't even developed the vaccine yet. So I'll let somebody else take the question on the flu, and anyone else.
And I'll let Dr. Dobbs jump in too. But I'm going to tell you, it's going to be complicated with the flu, because, you know, we already know that we have a significant impact from from influenza every year in Mississippi already. Certainly, some of the same populations can be impacted, but also others. And flu is a little bit different because we have a vaccine for sure. I think one of the big pieces that we're going to have to make sure that we do is good messaging around flu vaccine as well. And I think that, you know, we're going to have flu is not the only respiratory viral illness that we see in the fall. I think it's going to be a message of, you know, symptomatic. You need to continue to do those same measures that we're saying right now for COVID, and still get tested for COVID as well. And so I really do. I wish I knew what flu season was going to look like, but I think it's really going to be a challenge.
Especially if you can, I mean, one thing I think is pretty certain is that our health system can't take any more burden. It's at the breaking point now. We've got to push our COVID rates down way farther. And if we look at our ICU capacity, we're over ICU capacity. We're taking care of people in post-anesthesia care units. We're opening up rooms in the ER, using them as ICU beds. And staffing is really stretched as thin as it can be. So throwing flu on top of it, the flu vaccine is going to be very important to diminish that for health reasons, but also to preserve our healthcare infrastructure. But if we think about how bad it is in August, August is usually a pretty slow time for hospital utilization in Mississippi. And we're seeing 40% of our ICU beds essentially are filled with coronavirus. That's astounding for a single illness to occupy 40% of our actively utilized ICU beds. So imagine, you know, at some point you get over the number of percentages you can put together, and you're really going to be stressed out.
And depending on the flu season that we have, I mean, we've had flu seasons before that have had such a significant impact that we've had ICUs completely full of influenza-associated illnesses. And so, I mean, it could be a real crazy time.
Yes, thank you all for all those responses. This question is posed towards Dr. Dobbs. With students returning to school, can you explain to what extent contact tracing has been helpful in Mississippi, and what role it will play now as school is getting into swing?
Yeah, and I'll let Dr. Byers kick in too a little bit. First of all, I'll talk about the challenges of contact tracing. So we actually we did case investigation contact tracing pretty much. We were at 95% of all cases up until about May. And then when we had this massive increase after Memorial Day, we just got overwhelmed and couldn't keep up with it. If you throw on top of that the testing delays or the lack of reporting of testing, especially with these rapid results, the utility of case investigation really drops off quickly. So it's going to be a challenge. One of the things that's been challenging from the global perspective of how do you respond to coronavirus is we have a media cycle that jumps from one miracle option to the next, right? It's going to be, we just need 10 million contact tracers and we can control it. We need everybody tested and we can control it. We need, we need masks and control it. It's going to be all these things together. I mean, it may well be that the vaccine is actually the thing that will kind of get us ahead where we're going. That being said, there is a lot of usefulness with case investigation, contact tracing. You get a lot of useful information out of it too. We've actually, one of the most important things we're getting now is usable sort of surveillance about on the ground what's going on with people who get infected, so that we can direct policy and understand where interventions need to happen. But we also identify that we don't have really the ability to do strict contact tracing on every case in Mississippi right now. It's just not practical. But what we can do, and what Dr. Byers and his team is, they're reshifting their focus to student age folks. And Paul, I don't know if you want to talk about that at all.
Yeah, you know, and one of the challenges we have too with trying to prioritize cases to investigate is oftentimes incomplete information that we get through reporting, which can really make it difficult too, because you can think about, well, we want to prioritize this particular group because of some underlying chronic medical problem or because of their higher risk, and when you don't get that information on the front end, it's a real challenge. But what we're trying to do right now is shift our focus to those individuals 24 years of age and younger, especially on those kids 18 and younger, because what we're trying to do is have some real visibility on what's going on in schools and the college settings, and be able to get some more real-time information to really have a big impact. And I think that, you know, not only will we have some better visibility of the cases that are occurring, we'll have some better communication with the schools, but we also have opportunities to prevent transmission and be on the front end of that, with an understanding that all of the other barriers that we're seeing to things like the delay in reporting will still be there.
And with the school systems already, if y'all are following it, we basically have done sort of mini training exercises with each, well, with all the school districts essentially, about who gets quarantined, what does that mean, so that they're already, you know, a mile ahead by the time we're even sort of on the scene. They know who needs to be quarantined, what duration, what, and so if we can do the same thing with the colleges where they can act before we even get involved, if you save a day or two in that sort of process, you've really done a good job of minimizing transmission among the folks who are going to be exposed.
Thank you, thank you. I'll ask one more question, and, and then Cherie will ask for any more closing thoughts. So one of the questions, the last question we'll pose: would Medicaid expansion make a difference in COVID-19 treatment in Mississippi?
I mean, access to care is a big issue in Mississippi. There's no doubt about it. And if we had Medicaid expansion, a lot more people would have access to care. It's undeniable. It would also help support our fragile health systems. So yeah, I mean, we need everybody to have insurance. I mean, that's something that's should be a objective of modern societies. So there would be definite benefit.
This is Marshall. I completely agree. Not only would it decrease the COVID-19 disparities, but it could also and would probably, from the data, decrease chronic health disparities that also exist within the state. And I know that a few of my family members were concerned about even going to get tested because they were concerned about how much would it cost. And we're not talking about the long-term effects from COVID-19, the financial costs. People will start receiving hospital bills if they have not already, as well as the psychological costs of COVID-19. And so Medicaid expansion would assist with both of those, with expanding not only access to medical services, but also access to mental health services.
Yeah, can I just jump in with one last comment on this issue of Medicaid expansion? We are the only major industrialized country in the world that doesn't cover all of its folks, doesn't cover all of its citizens. And so whether you think it's Medicaid expansion or some other means, but the bottom line is, I believe that we should live in a society where everybody gets access to healthcare. That's a moral decision, that's a value call, but I just think that's the kind of society we ought to be. And the fact that we still have 35 million Americans, actually that's pre-pandemic, and the numbers are worse now, who don't have access to healthcare services, I think is a travesty. And I think it's not something that we should be okay with. And we got to keep working on that to bring that number way down.
Okay, at this time, we'll ask for any closing remarks from our panelists.
Hey, this is Paul again, and I think, you know, the biggest thing that I want to make sure that everybody understands, and certainly everybody in this crew does, is that we are not done with COVID yet. We still have a rocky road ahead of us, and we still have lots of challenges ahead of us. It's regrettable. We are going to have a whole lot more cases in Mississippi, and we are going to have a whole lot more deaths in Mississippi. And I have to tell you that each one of these deaths feels like it's piling on every day. And anything that all of us can do to impact um, change, impact all of those measures that we talk about to prevent transmission, I think is on the table.
And I would just ask everyone to be an advocate for science. Don't let politics determine what science looks like. It needs to be objective, and we don't need to get our news from Facebook. So let's get our science from the New England Journal, not from Facebook Medical School.
And let me just add, it's hard to top that. That's a great line, and I of course agree with it completely. Remember, we're all in this together. This is a global pandemic, and it's affecting all Americans. While there are certain communities and individuals who are more affected than others, I think if we pull together and act like we're all in this, even if your individual risk may be low, you may then spread it to somebody you love whose risk may be higher. So thinking as a community and thinking as a group and as a people, as opposed to individually, I do think we can get through this. We have many hard months ahead of us, but if we do the basic things, we can make a lot of difference, save a lot of lives, and that's worth it in my mind.
And I want to close by saying I agree with all the speakers, but I want you guys to stay the course. I care about all of you all in Mississippi. So one death is one death too many. And even if we reduce those numbers, one death is one death too many. My mom's a school teacher. My father is a police officer in the school system. And I'm concerned about their health. And so contact tracing, all of those things will not fix a solution. And so our millennials and the youth of today are very tech savvy, they're resilient. And so we just need to continue to stay the course, be safe, and hopefully we'll have a better day soon.
Thank you all so much for joining in our conversation and helping to educate our college community, family, and friends on the importance of COVID-19 and its effects on the African American community. We would like to, of course, thank our panelists once again. We would like to acknowledge Shulu College, not just a historically Black college and university, but historically bold, conscious utopia. The Jackson Hart Study Undergraduate Training and Education Center, President Walters, and the Office of Academic Affairs for their Zoom support. Lastly, I would like to thank my co-moderator, LaBelle Williams, and
thank you, Cherie. Thank you. We would also like to acknowledge that Jeremy Bingham for IT support, the funders of the Jackson Heart Study, the National Heart, Lung, and Blood Institute, as well as Dr. Jingy Mao, Dr. Victor Sutton, and all students and participants. We'd also like to thank Dr. Wendy White, and I would like to thank my co-moderator, Ms. Sidonia Cherie Thomas. And with all of the acknowledgements on the table, it's 7:03. We really appreciate you all for attending this conversation. And as Dr. Lee so eloquently encouraged us, please continue to stay the course, stay safe, and be advocates for health in your community. Thank you all for coming and have an excellent afternoon.
Thank you.
Thank you all. It was a pleasure.
If we have anyone from the media still on the call, feel free to stay on for any questions or concerns. Okay, and we'll take just 2 minutes. If there are any media in the remaining members, please go ahead and put that in the chat so that you can be unmuted.